In honor of National Mammography Day, we wanted to start a conversation with you about taking control over your health as it relates to breast cancer. So joining us today is Dr. Erika Hamilton to help us put our fears at ease. She's the director of the Breast Cancer and Gynecologic Cancer Research Program, Sarah Cannon. Hi, Dr. Hamilton. How are you?
Hi, thank you so much for having me.
Thank you for joining us. Mammograms can be scary, especially if it's your first one. So Dr. Hamilton, I'm 37. Actually, I just turned 38. Sometimes I forget my age. Should I have had one? I have to be honest with you, and I want to be honest with our viewers right now. I've never had one.
Most women should begin around 40 unless they have a very strong family history or a genetic predisposition to breast cancer. So obviously that's an individual conversation between a woman and a doctor, but I think in the absence of those risk factors that 40 is very likely appropriate and you haven't missed out on anything.
Okay, good to know. Well, with 1 in 8 women being diagnosed with breast cancer in their lifetime, how can we get more women like myself to overcome the fear of getting checked?
Our current statistics look like only 65% of women over the age of 40 have had a mammogram in the past 2 years, and this really is just way too low. I think that fear, as you mentioned, really does drive a lot of women. People don't like going to the doctor. They don't like going to the dentist. They're worried about the unknown. But I think it's important to get the message out there that mammograms catch these cancers early when they're very small and treatment is quite minimal.
And I agree. You spoke about the unknown. So can you describe the procedure for myself and for everyone watching who has yet to have one?
It's really a glorified x-ray. And so you step up to the x-ray machine and they position your breast into the machine and it takes a small series of x-rays. It really only takes about 15 minutes. There may be just a little bit of discomfort standing in an odd position, but it's not painful and it's really quite easy to do.
Thank you. 15 minutes that could save your life. Am I right? Preventative care is the best care. So Thank you for joining us, Dr. Hamilton, and helping us spread awareness and for easing my fears. For more information, go to sarahcannon.com or speak to a registered nurse by calling 844-482-4812. Thank you.
Thank you.